Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast today. And this audio podcast is part of the Hypernet. This audio podcast is part of the BRIX and Bash. This audio podcast is part of a squad and crisis and inspectorate. And this audio podcast is part of a Storm Robotics production and Interlude. And in this audio podcast today, I'll look at works in around a particular condition, a particular health condition referred to as or known in the literature as joint hypermobility syndrome, or JHS. This works was so there's some collaborative works that took place in around 2013, and where there's one team in the southwest United Kingdom had looked at diagnosis, management, and assessment of adults with joint hypermobility syndrome, or JHS, and it was a UK sort of survey of physiotherapy in around physiotherapy practice. So a little bit of intro, a sort of intro in around this. So joint hypermobility syndrome, or JHS, is a hereditary disorder associated with excessive joint range of motion and pain in the absence of inflammatory joint disease. Symptomatic joint hypermobility has been reported to affect approximately 5% of females, and about 0.6%, or just less than 1% of males. Although it is a common cause of pain, it is generally understood to be under-recognized and poorly managed in amongst clinical practice or practices. So the aims and objectives, the aims and around this was to identify how JHS is diagnosed, managed, and assessed in amongst routine physiotherapy practice or practices. The methodologies around this was wherein there were successive drafts of a survey were co-developed from sort of similar practice surveys, and a literature review and sort of consultation with investigators and clinicians took place before being finalized. Paper copies of the survey of the questionnaire were sent to in around just over 200 randomly selected secondary care organizations across the United Kingdom, and an electronic version was also advertised through physiotherapy professional networks. The results or analysis, there was analysis and that then were presented using primarily descriptive statistics. The results or the main analysis were where a total of 66 responses, about 80% of female were received from physiotherapists with a broad range of clinical experience. Just under 70% of respondents reported that they had not received any formal training on the basis of JHS, or joint hypermobility syndrome management. Just under 70% of respondents reported not using the recommended Brighton, what was referred to as the Brighton diagnostic criteria for JHS, joint hypermobility syndrome. In the literature, listeners in around this audio podcast, just to inform that in the literature amongst literature regarding joint hypermobility syndrome, JHS, there is literature that sort of iterates in around what is referred to as the Brighton diagnostic criterion. It's a specific diagnostics diagnostic sort of assessment to determine the severity of joint hypermobility syndrome. An average service offers a sort of a first assessment of at least 40 minutes, follow-up appointments of about 30 minutes or less, with a maximum of six sort of sessions across 4 months. 30% of respondents offer sort of maintenance reviews are sort of always or frequently. Additionally, the stated aims of physiotherapy in context of JHS, joint hypermobility syndrome, and the specific interventions employed seemed well interlinked, with a focus on advice, education, and self management. At the same time, although pain relief is not sort of reported as a sort of high priority in amongst treatment modalities, aims, for example, pain was most often assessed as an outcome, suggesting the lack of interlink between what clinicians, for example, aim to achieve and what they look to determine. At the same time, and as part of the sort of conclusions, is that the analysis suggests that reported management strategies are broadly appropriate to long-term musculoskeletal conditions, but that additional training specific to joint hypermobility syndrome may be required, particularly in regard to diagnosis and assessment. It is not possible to comment on. It was not possible, unfortunately, to comment on sort of the appropriateness or effectiveness of JHS or joint hypermobility syndrome, a service or services amongst the joint hypermobility or syndrome or JHS sort of services, there may be some similarities, however, to those described for other musculoskeletal services. Further education and training aspects in around and pertaining to JHS may be required for physiotherapists in as part of where this team had determined from their analysis and from the work to adequately recognize and diagnose and manage and also assess JHS, joint hypermobility syndrome, and more aligned to sort of evidence based works. So that draws this audio podcast to a close. There will be some references or citations that can be referred to for listeners who look to check out this particular audio podcast. So that draws this audio podcast to a close. This audio podcast is part of the Hyphenet. This audio podcast is part of the BRIX and Bash. This audio podcast is part of the Squall and Crisis and Inspectorate, and this audio podcast as part of a Storm Robotics production and Interlude.